We are pleased to introduce our group, which consists 4 members. First, we have Sunny Tan Wee Ji. Second, Lucas Chan Zilong. Third is me, Mr. Wong Leong Yang. And fourth, Mr. Lim Boon Yong. Together, we have collaborated closely on this project, combining our individual strength and effort to achieve our shared objective. Introduction to Visual Field Perimetry. Visual Field Perimetry is an important clinical test used to measure the range and sensitivity of a patient's peripheral vision. One of the most widely used instruments for this purpose is the Humphrey Visual Analyzer, a fully automated perimeter known for producing reliable and reproducible results. The HFA is mainly used to detect glaucomatous visual field loss, monitor disease progression in glaucoma and other optic nerve disorders, identify neurological visual pathway defect, and assess vision loss caused by retinal or neuroophthalmic condition. By providing accurate and repeatable measurement, the HFA play a vital role in early detection and diagnostic and ongoing management of various eye and neurological disease. The main objectives of this test are: first, to assess monocular vision field sensitivity, allowing us to measure how well each eye detects visual stimuli. Second, to detect and document scotomas, or area where the patient has reduced or lost vision. Third, to provide baseline and follow-up data that will help clinicians to make informed decisions for diagnosis, treatment, and monitoring of eye and neurological conditions. By achieving these objectives, we can ensure early detection of vision problems and track change over time for better patient care. This is the label diagram of Humphrey Visual Analyzer. First, the chin rest, located at the lower front of the machine, support the patient's chin to keep the head steady and in the correct position during the test. This stability is essential for accurate measurement. Second is the test bowl. Positioned central in the device is the large white dome where light stimuli are projected. The patient focuses on a center target insert to this bowl while different light appear to map their vision field. Third is the visor handler. Found on the side of the testing bowl is used to open or adjust the visor for patient access and positioning. It allows easier entry for the patient head and ensure the bowl is properly enclosed during testing. The fourth is the forehead rest. Located just above the chin rest, support the patient's forehead to maintain the correct alignment. It prevents forward or backward head movement, helping the patient stay focused on the target. By knowing the location and function of each part, both operator and patient can understand how the device works and why proper positioning is so important for reliable results. In the first picture, we see the several key control and connection. The patient response button connection is where the handheld response device plug in, allowing the patient to signal when they see a light. The patient response button itself is used by the patient during the test. The chin rest control located below the chin rest is used to adjust the height for proper patient positioning. The touch screen on the front panel allows the operator to set up and run the test. The off-off button powers the device, while the USB connection can be used for data transfer or accessories. The audio output is for connection, external sound device, and the speaker output system audio signal. In the second picture, we see the location side panel, which houses various ports and connection points for the device function. In the third picture, the ports are shown in detail. The 12-watt power outlet connects the device to its power source. The display port can connect to an external monitor. The USB port allows for data transfer or connection of peripheral The external port is used for network connection, enabling data sharing and software update. By understanding the location and function of this component, operator can efficiently set up, operate, and maintain the harm-free visual field analyzer. The visual field test should be conducted in a quiet, dimly lit room to help the patient focus and reduce distraction. A calm environment ensures that the patient can concentrate fully on the test target without being disturbed. It is also very important to maintain a stable temperature and humidity in the room. This not only keeps the patient comfortable but also helps prevent equipment error or performance issues with the harm-free visual field analyzer. By controlling the environment, we improve both the patient's comfort and the accuracy of the test result. To maintain hygiene and prevent cross-contamination, clean and disinfect all patient contact points before and after each test. Use approved wet or mild non-alcohol disinfectant to clean the chin rest and forehead rest and patient response button. Always use a sanitizer occluder or a fresh disposable eye patch to cover the non-tested eye. If reusable accessories are used, disinfect them thoroughly between patients. All staff should wash or sanitize their hands before and after assisting each patient. Following this measure ensure a safe testing environment and protect both patient and staff. Now, I will pass the presentation to Mr. Lim, who will follow up with the next section on patient preparation.
Thank you, Wong. I am Lim Bunyong. Let's talk about the patient preparation. Before conducting the visual field test, it's important to make sure the patient is fully prepared and comfortable. Begin by explaining the purpose of the test in clear and simple terms, so the patient understands what will happen. Adjust the sitting position, chin rest, and forehead rest to suit their height and posture, ensuring a stable and relaxed position. Confirm that the patient feels at ease and is ready to proceed, as comfort and proper position are essential for maintaining focus and achieving accurate test results. Gather relevant background information from the patient is very important. This includes recording any ocular conditions such as glaucoma, cataract, or retinal disease, as well as systemic conditions like diabetes or neurological disorder that may affect vision. In addition, reviewing and noting any previous visual field test results allow for direct comparison with the current finding. This helps the clinician detect changes over time, track disease progression, and make informed decisions about diagnosis, treatment, and follow-up care. By taking a true history, we can interpret the test result more accurately and provide better patient management. About patient briefing, also explain clearly to the patient, like this test measures your peripheral vision. Please keep your eyes focused on the center light for the entire test. Press the button every time you see a light, even if it appears very faint. The test is no timer, so you can take your time and bring whatever you need to. This instruction helps the patient understand the procedure, stay focused, and respond accurately, which improves the reliability of the visual field result. Now, let's look at the diagram. That's important to make sure the patient's head is positioned correctly. The chin should be placed firmly on the chin rest, and the forehead should rest against the forehead support. This helps keep the head steady and prevent movement that could affect the results. If needed, adjust the patient's chair by moving it closer to the instrument, so they can sit comfortably without leaning forward or stretching. A stable and comfortable position allows the patient to focus better on the test target, improving accuracy and reliability. And remember to cover the eye that is not being tested. This is done using a clean, sanitized ocular or a fresh eye patch. Proper occlusion ensure that only the test eye is used, preventing interference from the other eye and ensuring accurate visual field results. If the patient requires near correction, insert the appropriate near correction lens into the lens holder. Make sure the lens is positioned properly so it does not cause diffraction or block the patient's view of the target. Correct placement of the lens ensures a clear image, prevent visual distraction, and help maintain the accuracy of the visual field test. I will now hand it over to Mr. Sunny to continue with the next step.
Thank you, Mr. Lim. Good day, everyone. My name is Sunny Tanwiji, and I will now demonstrate what to do before starting the visual field test. After powering on the Humphrey Visual Field Analyzer, the first step is to open the patient data entry screen. Here, we input all the required patient's details to ensure the results are safe and linking correctly. This includes the full name, date of birth, and identifications number. Next, we select which eye will be tested, either the right or the left, and choose the appropriate test strategy such as SITA standard or SITA fast, depending on the clinical requirements. Accurate data entry is essential for proper record keeping, smooth follow-up, and reliable comparison with future test results. At this point, we will show a short video demonstrating the proper use of the Humphrey Visual Field Analyzer to conduct an eye examination for the patient. The Humphrey Visual Field, also known as a HVF, is a test performed to measure the quality of your visual field. It measures how wide and sensitive your central and side vision is. The HVF is an important test to detect any changes to your extent of vision. It is used in the diagnosis of some eye conditions as well as to monitor any progression of the eye conditions. This test is performed in the dark room, one eye at a time. Test duration for each eye is about 5 to 10 minutes depending on the type of test that has been ordered. The non-test eye will be covered. We will demonstrate the step you do be following for the HVF test. First, rest your chin on the left chin rest and lean your forehead forward to touch the forehead rest. Next, look through the lens and you will see a spot of orange light in the middle. The orange light is a physician's target. You need to look at this orange light at all times through the test. While looking at the orange light, you may notice small spots of white light that appear in the background. If you notice this spot of white light, press the clicker once. If you do not see any spots of white light, keep looking straight at the orange physician's target and wait for the white light to appear. It is very important to keep your eyes on the orange light. Do not try to find the white light by looking around, yet this will affect the reliability of the test. Also, do not move your forehead and chin away from the forehead and chin rest respectively. You are allowed to bring your eyes as per normal. It's okay if you think you miss clicking any of the target. You can proceed with the test. You have completed the test for the right eye. The same steps are repeated for the left eye. Once the test is finished, the system will display the result and reliability index. At this stage, we should confirm that the patient has completed the test correctly and that the reliability score are within acceptable limits. If the result meet quality standard, save the data to the patient's record and print or export the report for further analysis. This is an example of a printer result from the Humphrey Visual Field Analyzer. At the right top, it shows patient information such as the name, date of birth, and test date. The numbered sections display different parts of the result. Patient and test details for identifications and reference, numerical threshold values showing the patient sensitivity at each test point. Grayscale plot, a visual map of the field, where darkest areas indicate reducer sensitivity. Dodal deviations plot shows difference from age-matched normal values. Probability plot highlight area with statistically significant loss. Pattern deviations plot adjust for overall dispersions, like cat tracks, to reveal localized defect. Reliability index and test parameters, fixation loss, false positive, false negative, and test duration. By interpreting these sections together, clinicians can identify visual field defects, assess reliability, and track changes over time for accurate diagnosis and monitoring. After each test, we make sure the Humphrey Visual Field Analyzer is clean and ready for next patient. We wipe the chin rest and forehead rest using a soft cloth with mild non-alcohol disinfectant, taking care not to use too much liquid to avoid the excessive moisture that could damage the electronic components. The patient's response button gets cleaned with an alcohol wipe, and the outside surface are dusted daily with a microfiber cloth. Then check the trial lens. The liquid trial lens should be clear and gently cleaned with a lens-safe solutions. Manual trial lens are stored in a dust-free case and wet before and after use. We avoid touching any optical surface with our finger to keep them in the perfect condition, because with the fingerprint you cannot see too clear. This step keeps the device hygienic, protect its parts, and ensure accurate, reliable result for every patient. So next we have additional post-procedural management sections for the Humphrey Visual Field Analyzer, which will be introduced by Mr. Lucas. Mr. Lucas, please. Thank you.
Thank you, Mr. Sunny. Good day, everyone. My name is Lucas Chanzulong, and now I will introduce the post-procedure maintenance steps for Humphrey Visual Field Analyzer. Apart from a routine cleaning, it is equally important to maintain the device cooling calibration and data system. The air intake filter should be checked weekly for dust and cleaned with a small vacuum, while the rear fan should be kept clear with using a soft brush to ensure smooth airflow. The device should be calibrated daily or weekly using the built-in routine, ensuring the bulb's illumination and background brightness matches the manufacturer's specification. For data management, all patients' results should be saved and backed up at the end of the day, then exported to the clinic's storage systems to prevent data loss. We should also perform a mechanical and electrical check by making sure all calibrated cables are secure and undamaged, and that the printer has sufficient paper and ink. Software updates from the manufacturer should be updated and installed regularly to maintain accuracy and stability. Finally, at the end of the day, the device should be shut down properly and the bowl area covered with a dust cover to protect the optics overnight. If any issue arises that cannot be solved through the basic troubleshooting, we should contact the technical support personnel to carry out servicing or repairs. Following these steps keeps the instrument accurate, reliable, and ready for long-term use. Here are the quick reference flowchart for using the Humphrey Visual Field Analyzer following these few steps. For start, we prepare the environment. Ensure the room is quiet, dimly lit, and at a stable temperature. Next is the patient briefing. Explain the test and instruct clearly. After that, the data entry. Input the patient's detail and select the test setting. When ready, position the patient. Adjust their chest, chin rest and forehead rest for the patient's comfort and stability. Then, insert trial lens if needed. Next, occlude eye. Cover the non-tested eye. Next will be select test. Select the appropriate test sequence. Then proceed to run test. Run the test while monitoring patient's cooperation. Then after the test sequence ends, save and review the result. Repeat the same process for the other eye if required. Lastly, clean and power down the device, covering it with the dust cover for protection. Quality control for the Humphrey Visual Field Analyzer. To ensure accurate and reliable result, we follow clear quality control guidelines. The acceptable fixation loss rate should be 20% or less. False positive and false negative should also remain minimal, ideally below 15%. If the reliability indices goes beyond these limits, it is important to retest the patient to confirm the result. By monitoring these parameters closely, we can maintain the precision and consistency of visual field testing. Now let's move on to the troubleshooting of the Humphrey Field Analyzer. Sometimes problem occurs during a visual field test. One common issue is excessive fixation losses, which usually means the patient is not looking at the central target. In this case, we should calmly re-instruct the patients and repeat the test. Another issue is high false positive, where the patient presses the button too often, even when no light is shown. The solution is to remind them to respond only when they actually see light. Lastly, if the patients complain of blur vision during the test, it may be due to an incorrect trial lens. We should check the prescription and insert the correct lenses before continuing. By identifying these problems quickly and taking the right steps, we can improve the test accuracy and ensure reliable result. The Humphrey Field Analyzer is considered gold standards in perimetry, especially for detecting glaucoma and neuro-optomic condition. It offers high accuracy and reliability by using the CETA algorithm, which makes testing faster and more precise. The device provides comprehensive test options covering both central and peripheral vision with patterns like 10-2, 24-2, and 30-2. Its user-friendly interfaces includes touchscreen navigation and clear instructions for easy operation. It produces detailed, standardized printouts accepted worldwide for clinical and research purposes. The built-in fixation monitoring helps ensure the patient reliability during the test. It also has data storage and progressing analysis, allows the doctors to track visual field changes over time. Lastly, its benefits from wide availability of parts and strong after-sales support from Zeiss, including software updates and the servicing. The Humphrey Field Analyzer does have some drawbacks. First, it has a high purchase cost, making it less affordable for small clinics. Second, maintenance can be expensive because it needs regular servicing, calibration, and parts replacement like lamps and trial lenses. Third, it requires good patient cooperation. Poor concentration or fixation can affect the results. It also are bulky and stationary, so it needs a fixed place and cannot be moved easily. In addition, there is a learning curve for operators. Even though it's user-friendly, new staff needs training to interpret the result correctly. Lastly, some test protocols are time-consuming. While CETA fast is quicker. Full threshold test can take several minutes per eye. I will briefly compare the Humphrey Field Analyzer, in short HFA, and the Golden Perimeter. The HFA is an automated static perimeter. It is highly standardized, accurate, and produces digital results that are easily stored and compared over time. It is especially useful for monitoring glaucoma and other central vision field defects. However, it has limited flexibility because the test patterns are fixed. On the other hand, the Golden Perimeter is a manual kinetic perimeter. It allows the examiner to control the test in real time, making it very flexible and suitable for patients with special needs or for detecting large peripheral visual field defects. The results are drawn manually, and accuracy depends a lot on the skills of the examiner. In short, the HFA is best for precise, repeatable glaucoma monitoring, while the Golden is best for customized testing and assessing the far periphery. Both are valuable tools, but their choice depends on the patient's condition and the clinic's needs. The following is our reference list, which contains the sources and the materials we use in preparing this work. That concludes our presentation on the Humphrey Visual Field Analyzer. We hope our explanation has helped you understand the purpose, the procedures, and the maintenance, and the importance of this instrument in the eye care industry. On behalf of my group members, Sunny, Mr. Wong, and Mr. Lim, we would like to thank you for your time and attention. We truly appreciate the opportunity to share our work with you. Thank you very much.